Hello, this is basic presentation about the basic views of the left coronary angiogram, and it's basically directed for the SHOs and F1s to be able to identify the different views and which arteries the LED and which arteries the left circumflex. It should not take longer than 15 minutes, and feel free to pause in the video just to take some time and think and imagine the arteries as we go along. Right, so we're going to start by this picture. I'm going to be asking you to have a look at it, pause the video for a second, and tell me which one is going to be the LED in this view. Right, so regardless if you found the artery and you said like, oh, the LED is number 1, 2, 3, 4, or 5, or 6, and if you've done it, if you've guessed it correctly or incorrectly without a system, this is going to be making it difficult to identify the artery, maybe in more difficult views. So you should always have a system to identify which artery is which. So the most important thing is to identify the view first before you jump and say, this is the LED, this is the circumflex. Obviously, the more experience you get with the time, you're going to be able to do that straight away. The image below that, as you can see over there, is the C-arm. I'm sure that all of you is aware of the C-arm. I've seen it before in the cath lab or the radiology department. And this is basically the image intensifier on the top and the X-ray tube on the bottom. The patient is here on the table somewhere. The head is here. The foot is here. So the image intensifier can move in multiple different directions to create different angles of images. So again, this is the image intensifier. It can move towards the patient head, and that's cranial, and it can move towards the patient feet, and that is caudal. It can also move towards the left of the patient, and that's LAO, which is left anterior oblique, or towards the right of the patient, which is REO, right anterior oblique. It can also create multiple combinations between these caudal cranial movements to create different angles. So the first thing that you can see over there, this is basically AP straight, and if it moves towards the head, so that's AP cranial. If it moves towards the feet, it's AP caudal. It can also be on the left of the patient, so LAO straight, on the right of the patient, REO straight, or a combination between left cranial, right cranial, and that gives a right cranial and a right caudal, left cranial and left caudal, to give us different variations and different angles. So as we said in here, it can be AP straight cranial and caudal, REO straight cranial and caudal, LAO straight cranial and caudal. What we're going to focus on in this presentation is the LAO cranial and caudal, REO cranial and caudal views. Right, so let's get back to this view and let's decide first which view is this one. So in order to find out, we look at the diaphragm and the relation of the diaphragm to the cardiac silhouette. So if the diaphragm, which is the one over here, goes through the cardiac silhouette, which is that one, that is a cranial view. If the diaphragm is not visualized in the image or below the cardiac silhouette, that makes it a caudal view. The next thing that we need to find out if that's REO or LAO. There's multiple different ways. Ideally, I think that was the easiest way for me before we start is the open arms technique. But we're going to go through these three techniques to find out which one is REO, which one is LAO. So you look at the screen and this is the tip of the catheter somewhere here, and this is the body of the spine. And the relationship between the tip of the catheter with the body of the spine, or the tip of the catheter and the body of the catheter, but the body of the catheter is not shown here. So the tip of the catheter is left to the body of the spine, so that makes it LAO. The alternatively, but which is not really clear in this image, is the ribs direction and everything. We're going to show it in different images. Or the open arms technique, which is basically you open your arms wide and imagine that you're holding the tip of the catheter with one hand and the body of the spine or the body of the catheter with the other hand. If you do so for a second, you're going to see that you're holding the tip of the catheter with your left hand and the body of the spine with the right. The hand that's holding the tip of the catheter determines the direction. So if you're holding it with the left in this place, it's going to be left LAO. So this is an LAO view. Now we determined is the diaphragm crossing the silhouette, so that's cranial, and now we determined it's left, so that's LAO cranial view. More practice going on to the next one. Pause the video for a second and think about the view and think about the same things that we've done earlier. You can see over here the diaphragm crossing the cardiac silhouette or going through it, so that is a cranial view. Now you have multiple of options in here to determine how to determine if it's right or left. Tip of the catheter, relation to the body of the catheter, is on the right of it, so that makes it REO. Using the open arms, you're going to hold it with, if you open your arms wide, you're going to be holding the tip again with your right, the body with your left, that makes it again REO. If you see the ribs in here going down towards the right, that's another way to confirm that this is REO. So REO cranial view is this view. Now we look at this view, we cannot see the diaphragm anywhere in here, so that's going to be caudal view. Tip of the catheter is on the right compared to the body of the catheter, so that makes it REO, and we already established this caudal, so REO caudal. If you open your arms, hold it with your right hand, hold the body with the left hand, so that makes it again REO. So this is an REO caudal view. This is the last view that we have in here regarding these ones, and it basically not very clear images to be fair, but you cannot see the diaphragm, and the tip of the catheter is left compared to the body of the catheter, so that's LAO caudal view. That we call it spider view because it almost looks like a spider with the legs and everything going on from this view. Right. So now once we establish the views, we need to find out which artery is the circumflex and which artery is the LED. These are sets of the rules. The only rule that we need in here to make it easy is the first rule. Basically, the left circumflex follows the image intensifier, the LED, and its branches go to the opposite direction. Remember this, the circumflex follows the image intensifier. Let's apply this rule. So, looking at this view again, this is the diaphragm crossing the cardiac silhouette, makes it cranial. Looking at the spine, and the tip of the catheter is on the left, so this is LAO cranial view. So left cranial view. So the circumflex is expected to follow the image intensifier. So cranial, so it's going to be up and left, which is the case here. When we say left, it's the same way when we look at the chest x-ray and the left lung is somewhere here and the right lung is somewhere here. So this is circumflex, left main stem, LED, and circumflex. So the answer was number 2. But at least now you know how did we figure out it's actually the LED is number 2 rather than saying, oh, this one or this one because this one is bigger, this one is like turning around, whatever the angle is. Now, let's continue practicing. Let's go to the next image. Again, this is the diaphragm going through the cardiac silhouette. So that's basically a cranial view. And this is the tip of the catheter, body of the catheter relationship. This is tip is right compared to the right towards the body, so that's REO cranial view. So if we're saying REO cranial, this is basically the left main stem, cranial is up, that's the circumflex, and that is basically the LED. More practice. This image as well, we have said that we cannot see the diaphragm, so that makes it caudal, and with the relation of the tip of the catheter is right towards the body of the catheter, so it's REO caudal view. So if it's areocaudal view, the circumflex is expected to follow the intensifier in this setting. So you can find that caudal is down, this is the circumflex, and it's right compared to the LED. So this is the left main stem, circumflex, and there's lots of overlap in here, but this is the LED. Again, same thing, we said cannot see the diaphragm, that makes it caudal. Open arms technique, or whatever technique you prefer, you're holding the tip of the catheter with your left arm, and you're holding the body of the catheter with the right, so that's LEO caudal. So the circumflex is going to be down and to the left, so that's, say it here, and that's the LED, because that's got to be the other big artery. Sometimes there's ramus intermedius, which is the intermediate artery, but at this stage, don't really bother with it. Other rules that it's important to remember, that the caudal views generally are good for distal left main, proximal LED and proximal circumflex. Cranial views are generally good for ostial left main, mid and distal LED and its branches. This rule number 4 is very important, and it's going to help a lot. The artery on the border of the heart is very unlikely to be the LED or the circumflex. It's most likely to be obtuse marginals or diagonal. So let's look at this as an example. Again, let's identify this view. This, you cannot see the diaphragm, so that makes it caudal. And you look at the tip of the catheter here. We don't have a body of the catheter or a body of the spine. We cannot see it here, so it must be here somewhere. So the body of the catheter or the spine is here, and this is the tip of the catheter. If you imagine holding the tip of the catheter with one hand, the body of the catheter or the spine with the other hand, you're going to be holding it with the right, so that makes it areocaudal. Areocaudal, so the circumflex is going to go to the right and down, so this is the circumflex, and that's going to be the LED, LED, LED. What is this one? Is that the continuation of the LED? So this looks like to the border of the heart, and we already said that it's unlikely to be the LED if it's in the border of the heart. The LEDs actually should be somewhere here as a continuation of this massive thing. If you look at it in a different view, this is where the LED is supposed to be. So this is why it's important to take different views and looking at all the different angles. To be able to identify a lesion, ideally you should actually look at it on orthogonal view, which means perpendicular to the lesion, not in line with the lesion, to avoid missing it. Now this is basically just to break down the branches of the left coronary system. This is the left main stem, gives the proximal LED and the proximal circumflex. This is the septal branch of the proximal LED, and this is basically the diagonal branch from the mid LED. The second diagonal branch comes from the distal LED, and there's more distal perforators, and sometimes there's more diagonals. The proximal circumflex comes from the left main stem, the obtuse marginal comes from the mid circumflex, and more obtuse marginals can come from the distal circumflex. I hope this has been useful, and I think it's could be very useful if you look at the angiograms of the patients and try to determine which one is LEO, cranial caudal, REO, cranial caudal, identify the LED from the circumflex. Thank you so much.